everyone. It is my pleasure to talk to you today about some updates in advanced cervical cancer. My name is Christine Walko. I am a doctor of pharmacy and I am a senior member in the Department of Pathology and a senior member in the Department of Translational Pathology with a focus in precision medicine at Moffitt Cancer Center in Tampa, Florida. So starting just with a little bit of history, some of the main milestones for treatment for patients with advanced cervical cancer include what we used to use back in 2014 and before, which was platinum-based chemotherapy. So cisplatin paclitaxel or carboplatin paclitaxel, depending on whether or not patients had had prior exposure to a platinum agent. So this was really our standard of care. Then we found out that if you've looked at some of these other videos, you know that there is a strong link between the human papillomavirus or HPV and cervical cancer. And so we found out that HPV oncoproteins can actually mediate the upregulation of something called VEGF, so vascular endothelial growth factor. And because of that, then we looked at drugs that inhibit that VEGF. And so in 2014, the VEGF inhibitor, bevacizumab, was shown to have clinical benefit when added to chemotherapy. And so that became a treatment option if patients were candidates for getting that drug. There are some complications that can happen when you inhibit vascular endothelial growth factor, including bleeding. And so we have to consider the risk of bleeding and surgeries that may be happening, other things like that. So for patients who are a candidate for bevacizumab, that could then be added to the platinum-based chemotherapy backbone. Then in 2018, the Keynote 158 trial, so Keynote study, so that's going to be the drug pembrolizumab, was assessed in a variety of different patient populations. And that included some evidence in patients with cervical cancer. And it did demonstrate a benefit. And so pembrolizumab alone was approved for advanced cervical cancer in June of 2018. So just to kind of give that background, let's move into the Keynote 826 trial. So this trial was published back in 2021. It is a phase 3 study. So really it was looking at building on, we know that pembrolizumab works in the advanced cervical cancer population. Can we put it together with chemotherapy? And is that better than chemotherapy with or without bevacizumab? And so this trial included 617 patients with persistent, recurrent, or metastatic cervical cancer. They were randomized either to get the immune checkpoint inhibitor, pembrolizumab, with paclitaxel and either carboplatin or cisplatin, and then with or without bevacizumab based on if a patient was a candidate for it at their treating physician's discretion. And this was compared with placebo with the paclitaxel and either carboplatin or cisplatin, and then with or without the bevacizumab. So looking to see if pembrolizumab added to the chemotherapy backbone that we just kind of discussed would be beneficial. The endpoints for this trial were a dual primary endpoint, and they included both progression-free survival and overall survival. And they did look at the population based on the expression of PD-L1, so the protein or programmed death receptor ligand that is involved in the immunotherapy treatment, the pembrolizumab. So in the populations that they assessed included patients who had at least some positivity of PD-L1 with a CPS score of 1 or greater. And then they also looked at a population that had an even higher expression of PD-L1, so a CPS score of 10 or greater. And then they also looked at the intent to treat population. And so the CPS score looks at the number of PD-L1 staining cells in a tumor over the total number of viable cells. So kind of looking at, again, how much of the tumor is expressing this PD-L1. And so I have several results here. First of all, the main population that they looked at were patients with a PDL1 score that was with the combined positive score, the CPS score, that was 1 or greater. And you can see the patients who got pembrolizumab in the blue and the patients who got placebo in the red. We can see that these curves do split pretty much at their first assessment, and that the patients with pembrolizumab did end up having a 38% relative improvement in progression-free survival. Their hazard ratio here of 0.62, also this was statistically significant. It is notable that benefit was seen across the different histologies. So the histology, when the pathologist looks under the microscope and sees, is it a squamous cell? Is it an adenocarcinoma? Is it mixed? Regardless of what the histology was, benefit from the addition of pembrolizumab was seen across these populations. Additionally, it did not matter if patients received bevacizumab or not. So pembrolizumab benefited both groups of patients. And then finally, if we look over here at this forest plot, here's the PDL1 breakdown group. What we saw is that the patients who were negative, so less than 1, they did not have as much benefit, but patients who had 1 or greater and then 10 or greater, you can definitely see the benefit. And so down here, you can see that anything that is to the left of this line, the pembrolizumab was better. If it's to the right, then the placebo would have been better. But for both of these groups of patients, if you had a positive PDL1, then there was benefit from adding in the pembrolizumab. And then also you can see, as I mentioned, the concomitant, if bevacizumab was given, both groups of patients also had benefit here. And so based on this, we can now kind of continue our milestones. And pembrolizumab gained FDA approval in combination with chemotherapy, with or without bevacizumab, for patients with advanced cervical cancer who have a PD-L1 CPS score of 1 or greater. And this was approved in October of 2021.